This is Big 2 News at 10.
Coronavirus cases across our area could surge because of the Thanksgiving holiday.
Now hospital officials are preparing for the worst.
I'm quite certain that there's going to be one after Thanksgiving. I've just seen so many posts on Facebook about what people did over Thanksgiving, and it was really heartbreaking to see because I know how it's going to affect us here.
Big 2's Marco Ramirez spoke with local hospitals on how they're preparing for this.
He joins us live from the newsroom with more. Good evening, Marco.
Good evening, Jacob and Katie. Doctors say they hope everyone did their part over Thanksgiving to help slow the spread, but they're still preparing for yet another surge of COVID-19 cases.
We're doing a lot of counseling this week already since Monday about what to do as far as quarantining because of their own symptoms or exposure to a known or suspected case of COVID. So we know it's coming.
Since Thanksgiving has come and gone, Chief Medical Officer of Permian Regional Medical Center, Dr. Alyssa Rochterman, says another surge of COVID cases is inevitable, and that will cause even more problems.
Taking up so many beds and taking up so many other medical resources and not allowing us to be able to transfer patients to bigger hospitals. It's affecting patients who come in and get admitted for non-COVID things as well.
Dr. Rochterman says her hospital has been preparing for another surge with more supplies and medical staff. They have also teamed up with smaller hospitals who could treat non-COVID patients. But another COVID surge will have more devastating effects to healthcare workers like Dr. Rochterman.
Several physicians, nurses, respiratory therapists throughout our state and our West Texas region have died, and we know it's going to keep happening.
Other local hospitals like Odessa Regional Medical Center have been reaching capacity. Chief Medical Officer Dr. Rohit Saravanan says his hospital may have to turn to tents if more COVID patients arrive.
So are tents a real possibility? Yes, tents are a real possibility. But let's hope that we can make the space within the building of the hospital itself so we don't need to do this outside in tents.
But while we may not see the effects of Thanksgiving until at least 2 weeks, Dr. Rochterman hopes others will start taking this virus more seriously.
I'm just hoping that people maybe see what the after effects of that are and don't do it again for Christmas.
And the one thing Dr. Rochterman as well as other medical professionals have been encouraging the public to do is to be more considerate of the safety procedures that have been put in place. They say it will not only help protect you, but also protect our healthcare workers. Reporting live in the newsroom, I'm Marco Ramirez, Big 2 News.